Hi guys, welcome to today's video. In this video, I'll be showing you our central line placement. I'll be using a central line kit. So if you like this kind of content, kindly consider to like, share and subscribe. Without wasting much time, let us jump right into it. Welcome back. Now, in today's video, as I had introduced earlier, I'll be showing you step by step of how to place your central line. Okay, when you're inserting your central line, we use something we call a central line catheter, and it is normally found in a central line kit. This one, it is a central line venous catheter kit. This is what I'll be using. Okay, now the first thing you have to do is to position your patient. Now, assume your patient is lying on the bed in a straight position, facing upward, in the supine position. Now, you have to elevate a little bit on the foot side or the feet side, You elevate it, you ensure it's a bit higher than the side of the head. That is position we call the trend length back position. Okay? Now, after the patient is in trend length back position, you turn the head on the side a little bit so that you can be able to access here, this side, the jugular side. That is in the case of you want to place your central line on the jugular. We have different other sites whereby you can place your central line or your CVC. You can place it here on the jugular, the subclavian here, or the femoral, in between your legs, around that place. Okay, now jugular has its advantage. In case of bleeding, you can compress that side. Okay, now subclavian, disadvantage about it, it's pneumothorax. That is one disadvantage. In case of air, just know that patient will suffer pneumothorax. But its advantage is there is reduced risk of infections. Okay, infection at the site of placement. Okay, now we have done all that. You need things that you require during this procedure. You have to gather your requirements. Things you need, aside from the things that you will find in the central line kit, you will need an ultrasound, right? The ultrasound machine. You must place it using the ultrasound machine. The other thing, you need ultrasound cover. Some kits provide the ultrasound cover, but if you don't have an ultrasound cover inside your CVC kits, just look for another one, a sterile one. You need a gel, a KY gel or whatever lube that you use in your facility, right? Up to that point, I hope you are understanding. Another thing you need are the fluids, the liquids for sterilize, for at least cleaning that area before placing your, that is in the iodine, mostly the iodine. You need it prior to that procedure. Now, after that, we will open our central line kits. First things first, you must ensure your kit is intact. Your kit is not expired. Okay, I don't know why the screen is dark. Your kit is not expired. Okay, this is how it looks like. I will open it. This is for educational purpose only. Okay, you are provided with glove. This is size 7.5. Then you have drape. That is another thing. After you have washed or you have cleaned the site where you are placing, assuming it's the subclavia or the jugular, you will drape that area. This is a drape. You can see even this hole. You will drape that area. Now, the other thing that you need, I'm trying to gather to show you. What is in my, this is a dressing, this is another drape, These are dressings, eh? You need dressings. Then you need sutures, because after you've placed your central line, you have to hold it in position using sutures. So you have to suture that place, okay? Then you have some gauzes. You'll wash this, you'll wash the side, at least I'll wipe. Then you have your, this acts like a sponge holder, the sponge stick, to clean your area. At least you will soak this one in the iodine solution, then you clean it. This one, we have 3 in my kit. I have 3. Then this is how it looks like when it's opened. Then this is my, I hope I can focus. This is how it looks inside, and I will show you bit by bit of what is found inside my kits. You have to arrange the kits in the right, in a sequence as how you will require the. First things first, you will need this one. This is a syringe with a needle. We call this the finder needle. This is the finder needle. Then you connect it to, this is a needle, a normal needle, and a syringe. Then this one is the finder needle. This one, I hope you can see. This is, we call it the finder needle. I hope you can see how it looks like. It's the finder needle. I've said this video is for educational purpose only. Then these two, they can be red, they can be green. They're called dilators. Okay, so first things first, you will need, when you maybe don't have an assistant, you have to prepare yourself in a situation as to how you can pick easily. So you will start with the finder needle. Then you take the before you take the dilators, you need the guide wire. Let me show you the guide wire. This one, this is the guide wire. Then the finder needle. This is the dilator, finder needle, then the guide wire comes second, then the dilator. Then after that, the flash to prime your central line. Okay, this is a flash. Then sutures. I showed you sutures. You need sutures. Then you have this one. This is a, what do we call it? Blade, and it is number 11. You will also require a blade. Then a transducer. You have a transducer. You will need it in this procedure. How we do this thing? You see here, we have 2 things. Before you start using this one, the central line, you have to prime it. That's why we have here, what? This one. You have to prime your line, okay? You don't place it in your patient without priming it. You have to prime it. And after you've placed your central line, then you use the suture to suture the place. Okay, so an extra in my kit, I don't have a needle holder, but I have a blade holder. Blade. I have a blade, but I don't have a needle holder. So I'll add a blade holder here as an extra. Okay, I hope you're understanding what I'm trying to explain. Now I'll explain to you further if you request, how I'll do for you a video step by step of how these things are used. Okay, until next time, bye.